On this Tuesday night, ramping up the supply of critically needed personal protection equipment.
Extraordinary measures are required in these extraordinary times.
What $2 billion will buy and where it's coming from. Calls to relax rules for renters.
This is going to be hard on everyone.
As the rent is due and debts pile up. America's soaring death toll, the grim milestone the U.S. just reached. Plus, kickstarting the Keystone XL pipeline project, the lifeline Alberta is banking on during this crisis, and coronavirus questions from kids.
How long can we go to our friend's house and grandma's house again?
We will ask the experts.
Global National with Donna Friesen.
Good evening and thanks for joining us. We know so many of you are working day and night to help in this pandemic, and there are lots of developments tonight. We have news about more protective equipment and test kits on the way. But for some perspective, let's start first with the worldwide picture. The number of confirmed cases of COVID-19 is now fast approaching 1 million. About 20% of cases are in the United States, which still leads the world in confirmed cases, 180,000 and counting. More Americans have now died of this virus than died in the 9/11 attacks. And even President Trump now says April could be a deadly month. And as the cases soared, so does demand for personal protective equipment, or PPE. We know some hospitals in Canada are already rationing things like masks, that its burn rate, how quickly it's being used, is far higher now than usual because of the risk. Today, the federal government promised $2 billion is being spent to buy more.
Public Services and Procurement Canada is aggressively buying in bulk from all available suppliers and distributors. To date, we have ordered millions of swabs, gloves, masks, and other vital equipment.
We will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you.
The situation is going to get worse before it gets better.
There are long-term plans being made, worst-case scenario plans, knowing that medical equipment and ventilators are needed now and possibly for a long time. Some will be imported, some will be made here in Canada as companies retool and ramp up. Abigail Beeman has our top story tonight.
Quebec is burning through equipment 10 times faster than usual, a dire situation for the province with the most COVID-19 cases.
For some equipment, we have only for 3 to 7 days.
We have been able to cover all our needs up until this point and expect to be able to cover our needs for medical equipment in the foreseeable future.
The Prime Minister pledged $2 billion and says equipment will arrive in the coming weeks. Details on overall need and rollout are slim. The federal government has secured 157 million masks and 60 million N95 masks. Delivery for those and ventilators begins this week. Ottawa ordered 1,570 ventilators from Canada and abroad and is working to find at least 4,000 more. They've ordered more test kits too, but aren't saying how many.
Even though Canada is actually testing quite a lot of people, we want to do more. That is an absolutely critical area.
This emergency physician started a petition calling for a warlike effort and says today's announcement comes late.
We need to have access at least to the full suit. Like, it's ridiculous that we're just asking for one little mask when it's still on your hair and that sort of thing, and that we're begging for it.
Ottawa has been in touch with more than 3,000 companies that want to help, and today announced contracts with 3 of them for some of the masks, ventilators, and test kits.
We've signed an agreement to provide 500 ventilator systems to the federal government, and we also have an additional 40 more that will go to the province of Ontario.
We're also getting almost daily inquiries from other countries around the world and large corporations around the world. So we're proud Canadians. So we're definitely prioritizing Canada.
And that is why the Prime Minister stresses domestic production is so important, while Canada is also looking to find equipment all over the world. The problem is, so is everyone else. Abigail Beeman, Global News, Ottawa.
Here's a look at cases in Canada right now, and this is confirmed cases. We know not everyone with symptoms is being tested, and there's a backlog on tests in places like Ontario. More than 8,600 people are now confirmed to have COVID-19 in Canada. Quebec has the most people with the virus, more than 4,100 known cases. Ontario is second, nearly 2,000 cases. And in BC, more than 1,000 people have now tested positive. More than 100 people have now died of the virus in Canada. Those are not just statistics, those are individual people who are now being mourned by loved ones. And many lived in long-term care homes. At least 3 more people have died in one Ontario nursing home. The Pinecrest Nursing Home in Bobcaygeon has been badly hit. 12 residents there have died. So is a volunteer who worked at the home. Many of the remaining residents are sick, and at least 24 workers have tested positive. Each time we leave our homes, we increase the risk of spreading this virus and risk making someone so sick they die. Canada's Chief Public Health Officer outlined who she is most concerned about right now.
Our greatest concern at the moment relate to the introduction and spread of the virus in enclosed settings where vulnerable people reside. We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a corrections facility.
2 First Nations communities in Manitoba are asking the military for help to prepare for an outbreak there. In a letter to the Defence Minister, they're requesting a military hospital be built in their territories for testing and quarantining when the first cases are confirmed. And here's one indicator of how long we could be in this. Toronto Mayor John Tory today cancelled all public events in that city until the end of June. That includes all cultural events, concerts and festivals, including Pride Weekend.
This is not an easy decision to make. While we treasure many of these events and the important contribution they make to life in our city, protecting the health and safety of Toronto residents has to be our primary concern right now.
It is April 1st tomorrow, the day most people, individuals and businesses, have to pay their rent. And if you've got no money coming in, you are in trouble. There are some government measures to help. Ontario, for example, has given landlords a 6-month deferral on mortgages and has frozen rents and halted evictions. Mike Drolet looks at what else is being done to keep people and companies in place.
With an LGFG suit.
LGFG Fashion House's business is all about personal touch. But in a pandemic, bespoke suits are the first to go.
We saw about 480 appointments fall off the calendar in 1 week.
Founded in Calgary, they're now global, operating in 20 countries. With income dried up, they're now trying to save jobs by offloading physical office space.
There are a couple offices, obviously, that we are basically just trying to buy ourselves out of. But right now, the landlords are not very complicit because they're having a hard time.
Business throughout Canada is suffering, and the accompanying layoffs have left many individuals and businesses struggling to make rent. And while some landlords have agreed to deferred payments, one of the largest in the country, Smart Centres, told tenants in an email sent last week, obtained by Global News, that rent relief requests are premature and that they respectfully request the tenant honor its lease. Smart Centres says it is deferring payments on a case-by-case basis, and that email no longer applies.
It was like, eons ago in the scheme of this situation. We want them to be in business when this is over. We all want them to be. They are the, in a lot of ways, the heart and soul of our communities.
It should be noted that Smart Centres isn't the bad guy here. They too have bills to pay. So who has to shoulder this financial burden? Is it the banks, the landlords, the tenants, or even the government bailing them all out? France has taken the most aggressive approach out there by suspending rent and utility payments for small businesses, which economists say will set them up for eventually recovering faster than other countries. So what model should Canada adopt? The federal government is offering wage subsidies and small loans that are interest-free for a year, which restaurant owners argue puts too much of the burden on them. On the other end of the spectrum, a group calling itself Safe Hospitality is pushing for loan forgiveness. Economists say nobody is going to come out of this unscathed.
I mean, this is going to be hard on everyone, but I don't think it's just the government. I think all the players involved in the system, from landlords and even to banks, may have to look at foregoing some of the very strict rules they have about people paying things on time.
And they better figure it out soon, because the rent is due. Mike Drolet, Global News, Toronto.
The only thing that keeps businesses that are still open operational are truck drivers and delivery drivers. They spend their days on the road, and now many say they can't find a place to use the washroom. Today, Ontario's Premier had a message for businesses and gas stations to have a heart and open their washrooms to truck drivers.
Clean your washrooms, let them use your washrooms, because if it wasn't for the truckers, you wouldn't even be open. You wouldn't even have any items in your stores to sell if it wasn't for these same people that are hauling goods from one end of our country to the other and getting essential services through. So have a heart.
Those two cruise ships with nearly 250 Canadians on board have now reached Miami after they were stranded at sea for 2 weeks. The U.S. Coast Guard is now working with Holland America to plan when they can dock. The Zaandam is infected with COVID-19. 4 people on board died, and nearly 200 others are sick with flu-like symptoms, including at least 9 who have tested positive for the virus. Its sister ship, the Rotterdam, is carrying what we believe are healthy passengers, but neither ship has been able to dock in Florida because of fears the passengers would be a drain on already scarce medical resources in that state. To try to get a handle on what to plan for, epidemiologists do what's called disease modeling, projecting how this infection might spread. And the projections in the U.S. are grim. It has now surpassed China in the number of people who have died from COVID-19. New York City is overwhelmed, and the numbers are soaring elsewhere, too. Jackson Proskow joins me from Washington. Jackson, the White House laid out a sobering look at the models for when this might peak in that country. What can you tell us?
Donna, they're talking about 100,000 to 240,000 fatalities in this country if full social distancing measures are brought into place. At the peak of the epidemic, in a few weeks' time, they could see 2,200 deaths per day in this country. A short time ago, President Trump emerged and urged Americans to prepare for a difficult few weeks ahead.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. You're going to start seeing some real light at the end of the tunnel, but this is going to be a very painful, very, very painful 2 weeks.
100,000 fatalities is the best case scenario at this point, but getting there is going to be exceedingly difficult as states fight each other for vital supplies, and they're running into real roadblocks.
New York offers a grim preview of what's to come across the United States.
This is the scene outside my job right now.
An endless line of ambulances waits to drop patients at hospitals. The number of dead and infected continues to grow at an alarming rate. 1,200 members of New York City's police force are confirmed to have the virus. New York's governor announced his own brother, CNN news anchor Chris Cuomo, was one of nearly 10,000 New Yorkers to test positive in the last day.
It is the great equalizer. I don't care how smart, how rich, how powerful you think you are.
States now find themselves locked in a bidding war for scarce supplies, competing against each other as they all face the same problem. New Orleans says it will run out of ventilators in just 6 days.
Today we have about 86% of our patients and our COVID patients in our ICU are on ventilators.
Florida, New Jersey, and Michigan have reported worsening outbreaks of their own. Detroit is quickly becoming a hotspot.
This virus is going to continue to grow in the city for a period of weeks.
3 out of 4 Americans are under orders to stay at home. Residents of Washington, D.C. face the threat of fines or jail time if they venture out for any non-essential reason. While at sea, 4,000 American sailors are trapped in place on board an aircraft carrier where 200 have tested positive. The ship's captain sent a memo to the Pentagon pleading for a plan to help his crew.
Despite those sobering predictions, the White House has not strengthened its guidelines for Americans when it comes to social distancing. They have extended them for a full 30 days, but they're still voluntary, and some states are still not participating. Donna?
Not a good sign. Jackson Proskow in Washington, thanks. Africa's largest city now under lockdown. Coming up, how Nigeria is faring during this pandemic. Plus, forget going to the dogs. This town has gone to the goats. There is sorrow in Spain as the dead are buried. More than 849 people died of COVID-19 there today alone. That's the highest single-day increase in Spain. The death toll is now over 8,000. In the UK, more people died today, too, than any previous day. 381 deaths were recorded, pushing the total to over 1,700. And new data suggests the true death toll could be over 20% higher because official government figures in the UK do not include people who die at home and in care homes. Africa's largest city is now locked down. Lagos, Nigeria, a city of 21 million people, ground to a halt. 2 weeks of quarantine have been imposed on parts of that country. There are over 130 confirmed cases of COVID-19 in Nigeria, about 5,300 known cases across all of Africa. Still ahead, Alberta doubles down on its energy investments. Big news for the oil and gas sector in Alberta. The stalled Keystone XL pipeline project is being kick-started. The Alberta government is investing $1.1 billion in the project. TC Energy, formerly TransCanada, says that will cover costs of construction for this year. The 1,900-kilometre pipeline project, first proposed in 2008, would carry 830,000 barrels of crude a day from Alberta's oil sands to Nebraska, where it connects with the company's existing line to the Gulf Coast. Alberta is also giving a $6 billion loan guarantee so the company can finance ongoing construction costs. Keystone XL has been subject to all kinds of legal and environmental challenges, so why restart it now, especially when a barrel of oil costs about as much as a couple of cups of coffee? As Heather Yourex-West explains, Alberta sees it as an investment in the future.
The last few weeks have thrown Canada's energy sector into turmoil, watching oil prices sink to levels the industry has never seen before.
It is as bad as it's ever been, worse than it's ever been. It's too much oil being produced in the world. And as all of us stay at home, the demand for gasoline and jet fuel has really dropped.
This week, the price of a barrel of Western Canada Select dipped below $4, forcing oil companies to cut their spending as much as they can.
Capital budgets have been slashed by over $6 billion in the last 3 weeks in Canada. We're seeing a pullback on anything that companies can do to maintain cash flow for the time being.
The spending cuts have meant more job losses in a province that has been struggling with employment since the last downturn in oil and gas. It's why Alberta's government is now pouring more than $1 billion into the construction of the Keystone XL pipeline, trying to get Albertans working while the sector weathers this storm.
This is a big deal that will create thousands of jobs. It will help Alberta and Canada to recover more quickly from the brutal economic impact of the COVID-19 global recession.
But energy leaders say more will be needed as they await details of the federal government's promised $15 billion bailout.
We're talking to the federal government about pieces around liquidity, looking at what they did for the manufacturing sector in 2008 as one of the models. We're talking to them about regulatory flexibility.
Help needed to ensure small and medium-sized oil companies can make it through the coming months, so they'll be able to return to business once global demand rises again. Heather Yourex-West, Global News, Calgary.
Next, Curious Kids, our youngest viewers ask COVID-19 questions. Well, as any parent knows, kids can ask a lot of questions, and lately they've been wanting to know how long they're going to be stuck at home, out of school, and away from friends. Well, over the past month, Global's Jeff Semple has been taking some of your COVID-19 questions straight to the experts, and tonight he's taking questions from kids. Jeff?
Well, Donna, the Ontario government just announced it's suspending schools in this province for at least 2 more weeks, while other provinces, such as Alberta and BC, have already closed their schools indefinitely. And that has a lot of kids asking about this.
Why are playgrounds closed, and why am I not able to go back to school? That's all that I have to say.
Schools really serve as an incubator where the virus is actively spreading.
And that's particularly true in the case of COVID-19 because children's symptoms are mostly mild.
They're not that sick, but then they're bringing it home, and then that's where this just starts to multiply.
Hi, my name is Kristen. I'm 5. And how long would the germs last?
COVID-19's germs can survive on plastic, like a desk or play structure, for up to 3 days. So if you do leave the house,
don't touch your face, even if you get an itch, even if you want to pick your nose.
But what happens if you do get sick?
How long does it take you to get the coronavirus? How do you know that you have the coronavirus?
If people seem to have symptoms of cough or a cold or fever, if you're a kid, it's important for them to chat with their parents. And of course, parents, it's important to have a chat with your kids.
So there's no cure for the coronavirus and some people have recovered. How did they recover when there's no cure?
When you get sick with COVID-19, your immune system sounds the alarm and creates antibodies who fight back. Hopefully, after a few days, they deliver a knockout punch.
And they will have at least some form of immunity that will make it so they either don't get it again, or if they do get it again, it'll be more mild.
What's your name?
Foster, how many minutes are we going to be home and how long can we go to our friend's house and grandma's house again?
Unfortunately, medical experts say it's not a matter of minutes, but weeks.
I do think that these physical distancing measures are going to last for at least another 6 to 8 weeks, if not longer.
And as for visiting grandma, it's actually your grandparents, older people who are most at risk from this virus. So it's important to do your part to help keep them safe. Donna?
And find other ways to reach out. Jeff Semple, thank you. Jeff will continue to consult with experts and try to answer your questions. Send them to your questions at globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus. And that is Global National for this Tuesday. I'm Donna Friesen. All the lockdowns around the world have transformed some cities into ghost towns. And in one Welsh town, the goats have sensed an opportunity. These wild goats are taking advantage of deserted streets, roaming on roads, and grazing wherever they feel like it. Thanks for watching, and take care of yourselves. Bye-bye.